So as you can see from the images here, the Bolus guide is designed to clip onto our Sonoblate registered HIFU probe that is normally covered with a probe sheath and filled with cool, degassed water for the procedure. It's clipped onto the tip and snapped onto the neck, and then secured with tape. Then degassed water is added to the probe tip to directionally compress the prostate in the anterior direction. You can see the two screens here showing one probe without the Bolus guide, and the probe on the right with the Bolus guide. Here we see Dr. Sunao Shoji from Tokai University Medical Center, who is compressing the prostate using water in the Bolus guide. The prostate is visible between the two blue zones. The light blue is the 4 centimeters focal length, and the dark blue is the 3 centimeters zone of the prostate. It is dramatically and safely compressed by the Bolus guide. Here you can see in both views the size of the non-compressed prostate versus the compressed prostate, with almost 35 to 40% decrease in the AP, anterior-posterior, dimension or height of the prostate. Next, we show the directional compression in both the transverse and sagittal views of the prostate. The compressed prostate now uniquely fits within our treatment zones. The prostate is now centered in the transverse view and visible in both the sagittal and the transverse views provided by the Sonoblate HIFU system. The prostate can now be easily treated within 2 zones, thereby dramatically reducing treatment times. Here is Dr. Shoji, who developed this compression technique, also showing the multiple planes of visualization and treatment planning possible on the robotic Sonoblate HIFU system. Full treatment planning is possible in 3 views of the prostate: transverse, sagittal, and coronal, whereas other focal therapy companies may only provide 1 or 2 views. Dr. Shoji developed the directional compression technique in order to reduce shifting and swelling during treatment by 50 to 75% respectively. In addition, he showed a decrease in blood flow in the prostate, decreased treatment times, and increased treatment efficacy.